My name is Dr. Jeffrey Liu. I'm an orthopedic surgeon in the Dallas-Fort Worth area. I've been in practice here for about 3.5 years, and I specialize in sports medicine injuries. So I have 2 locations in the Dallas-Fort Worth area. One in Plano, that's the main office, and I have a satellite office now in Frisco as well. So I actually grew up in New Jersey. So I was born in New York City, and then I did my undergrad at New York University. Then I did my medical school in New Jersey at Rutgers University. And then I went cross-country to University of Southern California for orthopedic surgery residency. Then afterwards, I actually went to Texas. So I came to Houston, actually, and I did my sports medicine fellowship down at Methodist and Baylor down in Houston. So I actually was introduced to orthopedic surgery when I was a baby. As a baby, I had a bone infection in my leg. I didn't know this until I was a little bit later on in age, but my parents told me all the things I had to go through. So with the bone infection, I actually had surgery when I was a month old as a baby. And it took 15 years following an orthopedic pediatric surgeon for my bones to heal correctly. So I was introduced very young. So I kind of knew an idea what orthopedic surgery was, but then as I was doing my training, I really liked the idea of fixing or helping someone heal to get back to activity. So that's why I kind of went into sports medicine for the orthopedic surgery side of it. I love football. I love sports, I love playing sports. So anything sports related, I love to do. I've kind of took on and started playing more golf. And number 2 is actually my kids. So I'm passionate about my 2 daughters and watching them grow up and taking care of them and seeing how they learn new things every day is something I love. Board certification for orthopedic surgery is huge. So in terms of board certification, you, number 1, have to finish a orthopedic surgery residency, which takes about 5 years. Then you have to do some type of fellowship if you want to. But afterwards, you need to be able to practice for the first 1.5 to 2 years and collect surgical cases. On top of that, you need to present these cases in front of a panel of distinguished orthopedic surgeons that have been practicing for 20 years or so. And then you have to pass that. The board certification is extremely tough, it's very long. There's 2 parts to it I forgot to mention. One is you have to pass a written test, which you take, and that encompasses all 5 years of your orthopedic training. Then you take the oral boards, which is what I was talking about before in terms of presenting cases. So I think it's extremely important in terms of getting the standard correct for across the board for America, the United States, in terms of practicing. Standards are extremely important. So I think it's the most important thing for the United States, actually, to help with taking care of the patient the right way. So I think without standards, doctors can actually, some doctors can do one way, some doctors can do surgery or treatment the other way. However, there's no kind of evidence-based research on it. So with standards would kind of help with that, with putting all the research together, and then for all the doctors to kind of practice the similar way to help with the patient in terms of the right way to do it. It also gives patients an idea of if they walk into an office and the doctor tells them one thing, but then they know the standards are this, then they can kind of do their own research and figure out what can be the right way to go about. It's an honor, number 1, to be part of Top10MD, distinguished and mentioned as an orthopedic surgeon that's qualified to be able to take care of patients. So I'm very honored to be part of Top10MD.